we are going to be talking about the two bones found in the leg region. So we have your tibia and your fibula. As you can probably notice, these do not belong to the same individual, but we can get a good idea of how they would fit in the body. So the tibia is the larger of the two. It's going to be the medial, and then the fibula will be lateral. So this will be the weight-bearing bone in the leg. This is a non-weight-bearing bone. The anterior medial surface of the tibia is going to be subcutaneous throughout its length. So if you put your hand on your leg, if you think about where your shin would be, you're feeling this portion of your tibia. So very vulnerable to bruising in this region. Okay, so let's get oriented as to what we're looking at. We're looking at the anterior view of the tibia, and this is going to be the anterior view of the fibula. One way that you know that you're looking at an anterior view of the tibia is this region right here. So this big projection underneath the condyles, this is your tibial tuberosity. And your tibial tuberosity will always be anterior. So you know you're looking at an anterior surface. A way to be able to know what side you're looking at, if you look down in this region, this is your medial malleolus or malalis. So we know that that has to be the medial portion of the bone. So since this is the medial of the leg bones and this is a medial malalis, we know that this is a right tibia. And this is also a right fibula. Do not worry so much about determining what side your fibula you have, or what side of a fibula you have. Okay, so let's talk about the proximal end of the tibia. This whole region right here, is your tibial condyles, okay? So it's going to include this bulbous region right here, as well as the articular surfaces, which you can see a little bit better right here. Now, the way to know if you're looking at a medial or a lateral condyle is to find your medial malalis. The one on the same side will be your medial condyle, and then your lateral condyle here. It's going to be on the opposite side. This whole region, including the articular surfaces right here, is referred to as your tibial plateau. So this is where the tibia and the femur are going to articulate. So you remember the large femoral condyles, they're going to sit right here in terms of your tibial condyles. In life, you're going to have menisci sitting right in these regions to provide a better fit for those femoral condyles. In between the two articular surfaces, you're going to have what's referred to as an intercondylar eminence. And you're going to have a medial tubercle in there and a lateral tubercle to form the intercondylar eminence. So this is an attachment site for those cruciate ligaments, so your ACL and your PCL, as well as the menisci. So your medial meniscus will sit here, your lateral meniscus will sit here. Okay? So this whole region right here is important in terms of your knee joint and articulating with the femur. All right, so I'm going to put this back into an anterior view. And still looking proximally, so here are those the medial and lateral condyles. On the anterior surface, you're going to have this roughened region referred to as your tibial tuberosity. So your patellar ligament and your quadriceps femoris tendon are going to insert right into this region right here. So this is your tibial tuberosity, important in terms of determining whether you're looking at an anterior or posterior view. Now flipping this over, we're going to look at the posterior side of the tibia. So no tibial tuberosity, but you do have a crest or a line of bone right here. This is going to descend obliquely from lateral to medial. And this is your soleal or popliteal line. So your soleus muscle is going to originate in this region, but you're also going to have an insertion of the inferior boundary of the popliteus muscle. So that's why you'll hear it sometimes referred to as the soleal line or the popliteal line. So this nice ridge of bone or line of bone right here. Okay, moving back to an anterior view, we're going to look at the distal end of this bone. So you can see here your medial malleolus. This is going to be larger, more rugose than what you have for your lateral malleolus of your fibula. So a bony prominence on the medial side of your ankle, so you can actually palpate this on yourself. This is going to articulate with the talus in terms of your tarsal bones, and also this in this portion right here of the tibia is going to sit kind of right on top of the talus. So important in terms of forming that ankle joint. Okay, now we're going to look at the fibula. This is the lateral of the leg bones. This is not weight-bearing. It's a very important bone, though, in terms of muscle attachment. So that's why it is so oddly shaped. There are some very distinct lines on the shaft because this bone is here just for muscle attachment. It also will play a role in terms of stability of the ankle joint with the lateral malleolus on the lateral side of the ankle joint. This bone is a common source for bone grafting. So even after a segment of the fibula has been removed, walking, running, activity can go about normally with bone grafts in this region. Now there's a lot of confusion in terms of which end is the head and which end is the lateral malleolus. They do look fairly similar. If we zoom in on the head right here, you can see a fairly distinct articular surface right here. This is where you're going to have a proximal attachment to the tibia. Now remember that these are from two different individuals, so they don't fit together perfectly. But this is where you're going to have the proximal attachment for your tibia and your fibula. So a nicer indention in terms of the head of the fibula. To me, I always describe the head as a bit more bulbous, kind of more triangular, whereas the lateral malleolus is a bit more tapered and looks very similar to me, just on a smaller scale, to the medial malleolus. So very similar in terms of the malleoli, just on a smaller scale for the fibula. Okay, so going back to the shot. So right here is going to be your fibular head. So for me, I would describe this as larger. It's not quite as tapered as what you have for the lateral malleolus, articulating with the lateral condyle of the tibia. The fibular collateral ligament, or the lateral collateral ligament, is going to attach here. You'll also have an insertion for your biceps femoris in this region. Your fibularis longus will also be around here. Now, just inferior, this very pinched in region right here, is the neck of your fibula. Fractures to the neck of the fibula can damage the common fibular nerve. So it's right around here that you have it splitting into, the common fibular nerve will split in this region. So if you have a fracture here, that can cause injury to that nerve. Now looking distally, this is your lateral malleolus. It is going to be a bit more posteriorly placed than your medial malleolus. So when you palpate your lateral malleolus, it feels a little bit more posterior. It's articulating with the lateral side of the talus. And forcible inversion of the foot can actually cause the fibula to fracture kind of right superior to this malleolus. And this is often referred to as a Pott's fracture. So you can have, with forcible lateral displacement or inversion can cause a POTS fracture in this region.